Wear a mask and practice social distancing to reduce the spread. That's become a mantra for what's now become a COVID world. A recent study by MIT and the University of Oxford claims that the 6 feet rule may not be as effective as we once thought. Researchers say the coronavirus can travel 26 feet in the air through coughing, sneezing, and breathing without wearing a mask. According to the report, factors like poor ventilation, large crowds, and exposure time create more of a risk, as illustrated in the study's color-coded chart. Dr. Edward Nardell is a medical professor at Harvard University, specializing in airborne infections.
The 6 feet is just a number that gives a general idea of how far large particles travel. But once you get to small particles that remain airborne, they can travel much further.
Those smaller aerosol particles can stay in the air for hours and travel much farther than larger respiratory droplets. And with schools gearing up to reopen, safety measures are being closely analyzed. The CDC recommends that people, including teachers, staff, and students, wear face coverings in the event they can't be at least 6 feet apart. But experts now say that's just a general rule of thumb.
If you take off your mask and you have asymptomatic COVID and you're shedding virus, the fact that you're 6 feet apart for the small particles doesn't matter. So if you have 10, 20 children in a classroom and they're all exposed to somebody generating aerosol, the chance of transmission is real.
Is there some schools that can't necessarily afford the proper ventilation, and a remedy to that, they crack open a window or two? Is that sufficient?
I mean, a little ventilation is better than none, but better than that is to have the 6 or 10 air changes per hour that really reduce airborne infection risk.
Bottom line, good ventilation, limited crowds, proper hygiene, and mask wearing are key to reduce your risk of infection. The more you separate, the better off you'll be. I'm Stacey Ann Gooden, Pix 11 News.